Hi, my name is Brianna Howard. I'm a nursing student at EMU. I'm going to be performing a cranial assessment on my dad. So the first cranial nerve is the olfactory nerve. It is the sense of smell. But for the purpose of this video, we are not going to test that. The second cranial nerve is the optic nerve. We would start by doing a peripheral vision test, and I would do this by having the patient cover his right eye, and then I would cover my opposite eye, so my left eye. I would have the patient look into my other eye, and then I would hold up fingers down below in his visual field and above. And then he would repeat back how many fingers I'm holding up.
3, 1,
And then we would do that with the opposite eye.
2, 4.
All right, so I would say that he did that correctly. The second part of the optic nerve test would be visual acuity, which you would test with a Snellen chart. The chart would be 20 feet away from the patient. And then I would proceed to ask if he wears any glasses or contacts, in this case he wears glasses, so I would tell him to please put those on. He would view the chart at the lowest line possible that he could read. He would do this by looking with first his right eye, his left eye, and then both eyes. If he got 3 or more letters incorrect, he would have to move up a line, but this would mean that I would document that his vision would not be 20/20 in like the right eye, the left eye, or if it was both eyes. So if he had to go up a line, then it would be documented as 20 out of 30 or so and so. So I would say that his cranial nerve 2, the optic nerve, is intact. The third nerve is the locomotor nerve. This is a mixed nerve. It is motor and sensory. The first part is I would test the EOMs, which are the extraocular movements, and I would also look for nystagmus. I would do this by using a starburst pattern. I will have him look at the pen light, and I will move the pen light, and as I'm doing this, I will look for any extraocular movements. So I would say that the EOMs are intact and the nystagmus is absent. So the second part of this test is the indirect and direct pupillary movements or responses. I would first do this by putting my pen light into his left eye and seeing if his pupil constricted, and then I would do that with the opposite eye as well. We're also looking at perla, so we are seeing the pupils are round, that they are reactive to light, and that they are equal. So that was the direct way to view the pupillary response. And I would say that he had brisk constrictions. So his eyes were dilated to about 3 millimeters, and then it went down to 1, which is correct. The second test is the indirect pupillary response. I would do this by placing my hand midline of his nose, shining my light into his one eye. As I view the other eye, it should constrict as well. And then I would do this with the other eye and view the opposite eye and see that it constricts as well. Because both eyes should be equal and they both should constrict briskly. So after this, I would say that his cranial nerve 3 is intact. The fourth cranial nerve is the trochlear nerve. This tests for the last part of perla, which is accommodation. I would do this by having my pen about 3 inches from his nose, and I would move it inward and downward, and I would test to make sure that the patient is able to accommodate their eyes. So I would say that cranial nerve 4 is intact. Cranial nerve 5 is also a mixed nerve. I would start by testing this by having the patient open his jaw against resistance, and then I would palpate his temporal muscles. So I would say that that is intact. The other two parts of this, the sensory parts of testing for this nerve, would be the sensation of the face, cornea, and scalp. I would take a cotton ball and apply that to those places and test for sensation, as well as I would test his nasal and mucous membranes with a cotton tip swab as well. So I would say that cranial 5 is intact. Cranial 6, the abducens, is the lateral movement of the eyes, which we already tested in cranial nerve 3 when we tested for EOMs. So cranial nerve 6 would be intact. Cranial nerve 7 is the facial nerve. So it's the muscles of mastication or chew. I would test this by having the patient squeeze his eyes together tightly, and then I would also have him, I would test for the labial speech by him saying his name,
Matt.
and me seeing that both of his lips move together. I would have the patient smile, frown, and puff up his cheeks with air. So I would say that that's intact. The second part would be me testing for taste. I would do this by giving him something sour, sweet, and salty, and him telling me what taste he tasted with those items, as well as testing for tears and salivation. I would use a cotton tip to stimulate his cornea to test for a tear response, as well as giving him something sour to test for his salivation response. So overall, cranial 7 is intact. Cranial 8, the acoustic nerve, is tested by the whisper test. So I would plug the patient's ear on one side and say a two-syllable word in his other ear, and he would repeat that word back to me.
Volleyball.
And then I would do that at the other side.
Volleyball.
And so overall, I would say that that's intact because he's able to hear. It's intact due to the whisper test. We would test equilibrium as well, but we already tested that, or that would have already been tested in the head-to-toe assessment using the gait testing. So overall, cranial 8 is intact. Cranial nerve 9, the glossopharyngeal, is tested by having the patient say ah with his mouth open. And then I'm not going to perform this for the sake of the video, but I would have a glove over my hand and I would test for his gag reflex in his mouth. So cranial nerve 9 is intact. Cranial nerve 10, the vagus nerve, is tested by having the patient say his name and date of birth.
Matt, November 18.
I would document this by saying there's no hoarseness with the patient's verbalization. And then I would palpate for the patient to swallow, and I would have him swallow. So I would say that cranial nerve 9 is intact. I'm sorry, cranial nerve 9 is intact. Cranial nerve 11 is the spinal accessory nerve. I would have the patient move his head side to side with resistance, as well as up and down with resistance. I would have the patient shrug both of his shoulders with resistance. So in doing that, I would say that cranial nerve 11, the spinal accessory nerve, is intact. The last nerve, cranial nerve 12, is the hypoglossal nerve. I would have the patient stick out his tongue midline and then move it side to side, and then that would prove that cranial nerve 12 is intact. So this is concluding all of the cranial nerves and that they're all intact.